Guatemala is a multicultural, multi-ethnic, and multilingual country. The lack of culturally relevant health services results in women not visiting healthcare facilities for family planning counseling or pre- and postnatal checkups. They prefer to deliver their children at home with support of a midwife, because of healthcare providers only speak Spanish and they use the Western method to deliver babies. Midwives in Guatemala are empirical. Most of them have learned from other midwives. Besides, women cannot identify danger signs when there are complications. They have no emergency plans and they live in remote communities away from healthcare services. These are some of the reasons why the civil society has worked so hard to create awareness with the national and local authorities to establish a legal framework in order to reduce inequalities for healthcare access and foster respect for women's rights. Reducing maternal mortality is a commitment of the Millennium Development Goals, but maternal mortality ratio in Guatemala is one of the highest in Latin America. The main causes are maternal hemorrhage and hypertension. The timeline shows a moderate reduction of maternal mortality ratio. By 2015, the country should have reduced this indicator to 55 maternal deaths for every 100,000 live births. However, there still are big challenges to achieve the goal. In 2009, civil society developed the main framework context of a law initiative addressing safe motherhood issues. Civil society developed and implemented an advocacy strategy with government institutions, Congress, public media, universities, and professional bar associations. After a year of advocacy activities, the Congress representatives passed a Healthy Motherhood Law. In September 2010, the law was published, but the law was still lacking a set of regulations. For 2 years, the project supported the Minister of Health and Civil Society to develop the regulations and drive its approval through advocacy with decision makers, including the President of Guatemala, and so it followed up on the approval process. In 2011, during the general electoral year, the civil society developed a strategy designed to influence the presidential candidates, Congress representatives, and mayors to highlight the importance of health motherhood among the population. In January 2012, the current authorities assumed office and finally passed the law in April 2012. Once the set of regulations for the Safe Motherhood Law was published, it generated a series of actions by civil society supported by HEPP. The civil society actively participated in the Multisectoral Commission for the Healthy Motherhood as a process observer as required by law. The involvement of civil society has generated discussion and implementation of measures to improve monitoring cases of maternal mortality. Likewise, civil society became part of the Departmental Committee for Surveillance of Maternal Mortality, which were previously comprised just by healthcare service officials. In 2012, indigenous women started their monitoring activities in partnership with various organizations, including the Human Rights Ombudsman. The monitoring activities include service provision and conditions, staff, facilities, medication and supplies for maternal care and family planning. Based on their findings, Alian Mizar presents the results and requests to decision makers in order to improve health care. An important role of civil society is to keep maternal mortality topic in the media. The implementation of this law allows civil society to participate in monitoring activities and express their perspective on healthcare services and the reasons why women do not go to healthcare facilities.
Que actualmente también ya contamos con lo que es la Comisión de la Salud, que está integrado por diferentes instituciones, tales como lo es la Asociación de Comadronas y entre otras. Gracias a la asesoría de Red Mizar hemos logrado un presupuesto municipal para las mejoras de las instalaciones y algunos insumos que nosotros necesitamos como de oficina, de laboratorio y otros.
The law also provides women with rights to demand services as it establishes sanctions for public officials and employees who do not comply with the provisions of the law. In addition, the law sanctions the spouses or partners who forbid women to attend healthcare facilities or do not authorize transfers in case of complications.
Gracias a la Red Mizar, que es el que nos ha apoyado demasiado porque ellos nos han enseñado especialmente el valor que tenemos nosotros como seres humanos y el de utilizar el centro de salud. La verdad es que ahí hemos aprendido muchas cosas y gracias a eso nosotros ahora podemos ver el fruto del trabajo de la red.
Finally, the law also allows deeper analysis of maternal mortality relating into nutrition and social problems. In this context, the reproductive health watchdog launched the campaign Protect Me from Pregnancy, aiming to create awareness and promote attitude and behavioral changes regarding teenage pregnancy, particularly among girls under 14 years old. The campaign was supported by the government institutions, the civil society, the private sector, and international cooperation agencies. The number of maternal houses has increased in recent years, and they are a resource for women living in rural areas that have no transportation resources. Creating special areas for vertical delivery offers indigenous women the advantage of giving birth to their children according to their cultural preference, besides offering more advantages than the Western method. Assigning staff who speak the community's language has shown that it is essential for understanding between health personnel, women, and their families. It is also a condition for service quality and effectiveness. The Healthy Motherhood Law grants motherhood the character of national concern, favoring the most vulnerable population. It assumes universal, timely, and quality maternal and neonatal service provision, puts state institutions and guarantors of the right to health, defines duties and responsibilities of the state and its institutions for all pregnant women to cover their childbirth, postpartum, and newborn periods. We know that much remains to be done, but we believe that empowering women and men to participate and demand the fulfillment of their rights is the right way to get a better society and to build citizenship. This is a clear example of how, through civil society's advocacy and impact, it is possible to turn policies into actions.